Wrinkled, weathered, and saggy, just what you want to hear when it comes to your skin, right? Wrong. Our next guest, Debbie, says the aging rolls on her neck are so bad, she looks like the Crypt Keeper. Plastic surgeon Dr. Greg Mueller has just the fix.
I'm Debbie. I'm 53, and the day I turned 50, everything in here went this, and now I have all these wrinkles on my neck that I can't stand, and I look like the Crypt Keeper, I look like the Michelin Man, and I want it taken care of. Having 3 kids and a foster baby who is in diapers and working full-time, it's very hard to find time. I've heard that this procedure is minimally invasive, so that way I can go back to work soon and take care of my kids.
Hi, Debbie.
Hi.
How are you?
I'm good.
What we're planning on doing is doing a neck rejuvenation procedure. The Ellevate technology is a way for us to sew the underlying muscles and glands of her neck without surgically opening the neck area. And that will elevate and support her underlying muscles and glands. Chin up just slightly. She'll still have some bruising, but it's a much quicker recovery versus other traditional invasive procedures. And each of these circles represent zones that we're going to treat. And now we're just going to do a little lipo. It's pretty standard. We're going to go over to this side. We finish the lipo. We're going to lift up the skin so that we can do the skin tuck. You can see how much skin we're able to bring up. A little staple there. Just trim off the excess here. And you can see in and around the ears the tiny little incision. We're ready to get started on the Ellevate procedure. The first step is we're just going to mark the areas where we're going to place the little skin punctures. Everything anchors up here above this little incision behind the ear. It's just going to anchor up here in the hair, and the same on the other side. And that's the light that's going to shine through the surface of the skin so we can see exactly where we are. And the light tells me that we're right in the safe area, right in there, and safely just coming out to a little puncture. This has really created a really nice, youthful look for her, so I'm really happy with the results.
Debbie is here to reveal her results along with plastic surgeon Dr. Greg Mueller. Let's see her new look.
Was it worth it watching what you went through?
Yes. I didn't realize how bad it was, but if you look at the photo, it's amazing.
Very, very natural looking, which is what's really impressive. Is just you. I mean, you look more youthful, but very natural.
All right, so Doc, little shop talk here.
Yes.
As you see it, what's the biggest difference between what you did for Debbie and our more traditional classical face neck lift?
Sure. So what we did with Debbie is we actually sewed her neck muscles using a lighted needle and thread. And you all saw that light coming through the skin. That enables us to lift and support the muscles without having to surgically open the neck. Now, you saw me remove a little bit of skin, so we do a little bit of a skin tuck around the ears, but no opening of the neck in front of the neck.
So how much undermining or release of skin did you do in front in the face?
So we lifted up about 2 inches of skin around the ear and just lifted everything up and back.
So that's one of the big differences, that with a classical facelift that you're not adding these threads for suspension, that you would do more undermining, especially in the neck where you would totally release this. So in your mind, can Debbie expect longer lasting results?
Absolutely. So this is totally different. It's not a thread lift. This is a way of placing a matrix underneath the skin that'll last 5 to 10 years.
Who's the ideal candidate?
You know, anybody who's not happy. I would say anyone who's not happy with their neck, even younger patients who have sort of that ski slope neck are great candidates.
Who don't have a well-defined crease in the neck.
Exactly. And somebody who wants to see more of the angle of the jaw, which is a very popular aesthetic feature. And then as we start aging, somebody who's starting to show some signs of aging. It's a perfect.
Can I ask you guys a question for the plastic surgeons? When do you know that you're ready for a procedure like Debbie had versus maybe a little bit more in just the contouring side?
Well, such a great question.
How do you know
I mean, this show, over the
bullet?
years, we've talked about so many options, and the options out there now for facial rejuvenation are endless.
I think what's most exciting is over the last 5 to 7 years, new technologies have emerged that will tighten the skin. Things like radio frequency, laser beams that we pass under the skin. So when somebody starts noticing that things are starting to sag a little bit, then that's the perfect time to do a little touch-up to kind of hold things where they are. And that's what this procedure does.
And everybody is a little bit different. It's when do you come see us? Well, when you have something that's bothering you and you would like to improve for the right reasons, you're doing it for yourself, not for somebody else, etc. Then and we see it. We have patients coming in 20, oh, I want a facelift. I need a facelift. And that's the ethical plastic surgeon is going to say, well, no, you
That's
don't.
not what you
We're
need
not
right
doing
now.
a facelift. That you are not ready for that, but maybe you're ready for something else.
Truly a great result. You look
Thank you.
absolutely.
Dr. Miller, dare we ask the price tag on something like this?
Yeah, sure. The price tag for what Debbie had is around $25,000, and that's with skin removal. Now, someone who's a little bit younger who might want to have something like face-tight radio frequency tightening with this Ellevate procedure, then you're looking at about 10 to 15.
Okay, so talk to your doctor and
Figure out what's right for you, Debbie. Thanks again for coming, Dr. Miller.
Thank you.
Thank you.
We'll be right back. Coming up,